Hi, I'm Eric Lubau, and welcome to Beyond the Belt. This is a conversation with Petrus Paulus Steyn, a black belt out of Philadelphia, Pennsylvania, USA. Paulus is a pediatric anesthesiologist, assistant professor of anesthesiology and critical care, lifelong scuba diver, and father. I hope you enjoy our chat. Hey, Paulus, thanks for being here.
Hey, thanks for having me.
Tell me, what was it like for you to get your black belt?
A surprise, honestly. At my school, we promote people by our coaches, call them aside and tell them, hey, we would like to give you your black belt, but we want you to do a seminar the day of. It's their way of making sure, as a brown going to black belt, you can teach yourself stuff. And then by virtue of teaching yourself new things, you can then teach. And that's one of the things I think a black belt should know how to do. And so I was working on this project for a while, and
What was it? What were you teaching?
I was learning how to do lasso. I'm the classic 6 foot rugby playing bit of a bully on the mat, and I got away a long time with that. And then I never developed a proper guard. So long story short, my coach went, hey, you don't have a really good basic guard game, so I want you to work lasso. And taught myself lasso from scratch and made it a fun part of my game. So I was expecting at some point that somewhere they're going to tell me this. But what I've always wanted was the classic, hey, today here's your black belt. Tap on the shoulder, go on with the day. That's what I've always wanted for this. And they knew this. So a buddy of mine we came up through the ranks from scratch. He trains every day. He coaches every day, or most days. I don't. So I was anticipating him to get his black belt a year or two before me. That's just nature of busy lives. But he got his black belt the night before. I got that the next morning. I had no idea. I felt like a girl getting engaged too. And when you tell your girlfriends, hey, I got engaged, I had no idea what's happening. I really had no idea that this is happening, and broke out in tears. I still get emotional thinking about it. It was really quite a highlight for me. We They make you do a little speech. I said some random stuff on the fly. Mostly just how cool jiu-jitsu is. I have a couple of kids around me and younger, smaller female athletes with us who I'm impressed by the fact that they're 125 pounds, and even though I'm not fairly good at the sport for our practice, just are ninjas. They figure you out. They learn how to get from underneath you. They put in the time, and they like outsmart you and outgame you. And I'm always been impressed by that aspect of the game. So I said something about that, but for the most part, tears, a little bit shocked. Thinking about it now, I'm getting emotional. And definitely a highlight of all of us. We worked decades to get there, and I kind
So
of
when
like
did you
that.
teach your seminar?
I didn't. Josh, my coach, knew that I would have liked my black belt the old school, and that's what he did for me. And he's like, "Hey man, I knew this is what you wanted. You deserve it. There you go." And I kind of like that. I'm still got the seminar locked and ready, but I think they've moved on to better teachers than me.
That's kind of funny. Um, is there anything specific that you feel upset about as a result of that? Like, were you upset about the timing? Did you want like family or friends around that weren't there, or were you
So
just happy it went that way?
they did a nice job checking with my wife if she could be there the week before. And I would have liked my buddy from South Africa to come, but that's not practical. Um, but my wife smartly went, hey, I don't actually think Paulus cares if I'm here or not. Just make sure Mikhail and all these other buddies are there, and which they did. Mikhail did a really nice job of corralling he's like always the social mayor,
Yes.
corralling everyone and making sure all the buddies I trained with were there. So all in all, no complaints. I think they did a really thoughtful job for how I wanted to get a black belt.
That's pretty awesome. It's
Yeah.
great that like you were given kind of that option. I also like the idea that Josh does about having you teach something or having you learn something. But do you think that it's a good idea to check that everybody can teach? Because I feel like that's not a skill. You're a teacher. Like that's not a skill that everyone
Yeah.
has.
There's definitely one or two people who I knew who bowed out of that before me because they might have some social anxiety or they don't really prefer at all to speak around people. We've got one buddy on the mats who I think has said maybe 10 sentences to me in his life. And I like this guy so much. And I would say every time he says something, it's fucking hilarious. Um, Jason is his name. He's like, just doesn't like speaking around people. And they did the same thing for him. But I do like what Josh and Angie's thinking around it is, you need to, if not teach a group of people, you need to be able to teach yourself at some level. And you need to be able to figure out something difficult, integrate it and make it practical. And if you can do that, you're starting to progress to a level of understanding of jiu-jitsu that is not just physical. I think that's his thinking around that.
I think that's an amazing thought.
Yeah.
I think that's wonderful. I was really asking about the teaching because as somebody
Yeah.
who teaches jujitsu, and I look at other coaches, I've probably taken classes from between 300-400 coaches over the years. And there's just some people
Jesus.
who, well, I traveled a
Yeah.
lot.
Yeah.
There's just some people who can't convey the information. They can execute it, but they can't convey it. And so to make the average person who makes it to that level, like maybe to some extent embarrass themselves at their inability to communicate that information just because they can execute it. It's an interesting thought for me.
Yeah. And I think it was born out of their thinking about project-based jiu-jitsu. You've got this project. It's supposed to be something you don't know or you want to learn deeper about. And I think that's how all of us approach a problem. Right? At some point where no one can show with math, with science, with sport, at some point you got to go sit down by yourself and figure it out for yourself. And then you have to have some checks and balances. Like, do you really understand this? Okay, tell me about it. Okay, teach that guy, make him do it. And then I think that's a good place to be. But yeah, to your point, like not everyone's a natural teacher.
Well, like when I
So
think
at
about,
least you teach yourself.
yeah, but when I think about the thing you just said, the hole in that for me is teach that guy or teach that person unless they're built like you or have the same tendencies as you. It's like, yes, you should know the difference between, hey, if I'm going to do, like for your lasso guard, somebody with really short, stubby legs is going to have to execute lasso guard very differently than somebody with long arms, or if somebody's like very heavy or whatever. There's so many of these nuances that unless like how to teach or be aware of those other things, like you just know that you know how to do it and what happens if someone else has long arms or short arms. But to teach it, you have to be like, well, if I'm showing this person and their arms are short or their arms are long, or you're going against a barrel chest or a small chest, like all of these matter. And not everybody can think about it like that.
And I mean, and then more and more variables come in. At the end of the day, we're teaching the small guy, the short guy, everyone. I'm not small guy, wrong way around. But we're teaching everyone, like if the chin's up, the neck's exposed, if the elbow's away from the body, there's a whole list of things you can do. Get past the knees, get past the hips, how to pin the two things. If you've got your leg in between your legs, if you get your arm in between your legs, if you go head in between your arms or your legs, those are the 6 fundamentals of jiu-jitsu, I think. Um, and uh, um, and you want to understand it for your own body. And I think the next level is starting to understand each thing you're good at, what people do, and then the next level to that. I do that at my job where I teach high fidelity stuff all the time, where I can show you what I do, but you're not as strong as I am, or not as tall as I am, or not as comfortable with this as I am. So I need to be able to show you what I do, but also like guide you from where you're at um, to get get there. And I think in the same way I'm going around circle, but the same way with jiu-jitsu. Like you're right. Like my training buddy Paul is a little differently built than I am, and lasso he does it differently. He has
Yeah.
to get in real close. Yes, he can't do the deep lasso. He has to do the and then he finds himself at risk for the steamers and all that other weird locks that they
Yeah.
do well.
And
And
this
he's
is
got a
what I
problem.
mean,
But
is that it's
he's
important to know. It's important to know that you have to speak about it differently for different body types, not just the attacking, but as you yourself. So that's why I just thought it was very interesting that they choose to ask people to teach. I love the idea. I love the project concept.
and I mean that I think becomes like the higher level of of jiu-jitsu. Like you're starting to understand not just your own body and your own system, you're starting to understand other people's bodies and systems. That's kind of
Yeah.
magic, I think. Yeah.
I agree. I kind of love that about it. How did you get into jujitsu?
Um, when I moved to the States for my wife Rachel, who I met at the Soccer World Cup in 2010. She came out as a medical student. I was still a community service doctor in South Africa, and she came out for the Soccer World Cup. And long story short, that little romance had some controversy to it. At that point I was engaged, um, and Rachel came back to the States. I broke off my engagement. I didn't do it very well as a young man. It was messy and ugly, and lots of people got hurt. But a year later, I flew out to Chicago, where she was at, knocked on her door, and went, "Hey, remember me? Please don't mace me." And do you want to go for coffee? And I did that. And long story short, uh, I ended up coming to the States on various kinds of visas. So initially got into jiu-jitsu because right down the street from where she was living in Chicago, there was two brothers, the Richovich brothers, who had a big gym. And I looked online; they were good coaches. And that's to answer your question directly. I've always been interested in a good coach. Um, if I came to Philadelphia and there wasn't a good coach around, I would have done a different sport. And I just got lucky. I walked onto the mats and at Balance Studios at that point in Philadelphia, and I was needing something to do. Did martial arts all my life, and I was lucky that I had a good coach. I got here, and Josh's brother, um, and Judah, and a couple of folks who were around were like good teachers, and I just stuck with it. And then jiu-jitsu is just awesome. Like all of us who do it,
I
get
agree.
into it. I played rugby all my life, and I like to rough and tumble, and like, man, what a fun sport. And so it ticked all the boxes for me, and I got lucky that I got good coaches from the beginning.
What other martial arts did you do?
I did Kyokushin karate.
Okay, so you went for the hardcore stuff.
Yeah, I didn't. Again, same thing. I went to a couple of schools. Some of it was like I was a little suspect of some of the McDojo kind of stuff as a college kid, and I walked into this one guy from a Elsie's River in Cape Town. He's like my second dad. Addison, third or fourth degree black belt in Kyokushin karate. He went to world championships, go to Japan every year, takes his kids and stuff. And he was just a good coach. No fanfare, no formalities. Just this is the practicalities and limitations of karate. I'm going to teach you. I'm going to try and get you to get good at this. And we're going to specifically what get me stuck with him is like we're going to test it, in the sense that if you can kick into the air 100,000 times, but you should be able to actually fight someone. If you can't do that, no point in this game. And I kind of fell in love with it. So I did karate during med school, and it was kind of worked out nicely. 6 years of karate, got a black belt at the end, and I got my medical degree at the end, the timing was nice. But I stuck around for a good coach. That was how I got into karate.
Is that the thing that keeps you training nowadays? You just have like great coach, or is it community?
Yeah,
Or
look, I've got it. So for in this, like as a thing with you, right? Like when you went to Germany, like there's not a lot of people around you like are friends with, and people are friendly and they're trying to relate to you as best as they can. But different cultures. You're not around surrounded by your old friends, the people who you're missing out on old friends, right? So, and the older we get, the harder it is to make mates. So I stuck around jiu-jitsu for the people I met, scratched the social itch for me. And I remember standing in this, like after almost a year of not really speaking to people. When I got here, I couldn't work initially. And I remember just having a regular old locker room conversation. I'm like, oh, people I like. And they're kind of joking back with me and like, this is fun. And then I stuck around for the coaching. I thought Josh and some of the other coaches around me was like really thoughtful and masterful. I would argue that my coach right now would qualify for like an honorary degree in education. Okay, I know universities all over the world give away honorary degrees for certain distinctions, and I would argue that I could apply, and he would qualify for an honorary educator.
That's
Degree in
amazing.
it. Yeah, and that's why I stuck around. That's why I moved schools with him. I love the guys I was at. I were at. They're a good school. They're a good bunch of guys. They're like the classic machismo jiu-jitsu schools. But I mean, if you don't get good on that mat, you're not going to get good. I like that too. But I left to this new school about 5 years ago because of the coach. She was a masterful teacher. One day when you get a chance to speak to him, he can go into depth about jiu-jitsu. Like, it's mind-blowing.
I mean, I don't make it back to the U.S. that often, but I'm sure when I do, if I can drag my butt down to Philly, I will come visit you and Josh and Michaela and
I mean,
Heidi and
I've
everyone.
got space for you. I've got a house full of noisy kids, but you're welcome to come stay.
I might take you up on that.
Welcome to.
What was the toughest thing for you throughout your jiu-jitsu journey?
Or time, like everyone, right? Work a job. When I got here, I started in a training position where my time was not my own. I was a emergency medicine doctor in South Africa. And here I came and I did anesthesia from scratch. I did anesthesia residency. And so it was just time. Like, your day is not your own. You get up at 5:30, your day starts at 6:30 for education. 7, you have to be in the OR. It was 7:15, the patient's rolling back, and your day starts. And you don't stop until the cases are done. So getting on the match predictably was tricky. I couldn't be the night guy or the day guy or the afternoon guy. I had to be like whatever is available today guy. And that's the same for me today. Same with, I can't make our classic leg lock classes. So I'm kind of have to teach myself it by myself. And I'm just hilariously bad at leg locks compared to the rest of my school because I just can't make that class.
Yeah.
And so to answer your question, timing. Between 2 kids, 2 professional jobs, my day ends unpredictably almost every time. Getting on the mat consistently.
Why did you get into anesthesia? Like, if you had trauma training, why did you switch completely to a completely different field within medicine?
So coming to the States is tricky. Now in the 90s, when there was a doctor shortage, they opened the pathway for like doctors from all over the world, and they'll give you a reciprocal license. I had a reciprocal license with Ireland. As long as you're licensed as a physician in South Africa, we'll give you a license with some paperwork in Ireland. And the States used to do that in the 90s. And then they got all random kind of issues with people coming from all over the world who might not have the same standard of education or just different cultural educations. So when I came, I had to do redo residency. I could do residency as an ER doc. In most states, they would allow me to work supervised, and then I take the boards and they sign me off, but it's still residency. Or I got to be a kid again. Back in the day when I chose the one thing, and I kind of thought maybe anesthesia would be fun. So I came here, I'm like, let's try this, and I've loved it. What a good choice.
One of the things that I'm really curious about is not only did you choose anesthesia, you went and did pediatric anesthesia, which I imagine is like a whole other ball of wax. Like, why did you choose to work with kids at that point?
I'll give you the answer I gave the day I interviewed for fellowship. It's like, I love working with kids, man. Like, it's the biggest difference is cultural. Like, at being awake at 2 a.m. for some case that might not necessarily have to go right now, but the hospital system just kind of, the system just like allowed this to happen. Being awake at 2 a.m. for a kid, so much easier. And the entire OR mindset is different. We might not need to be here right now. This is kind of bullshit, but also this is the best thing for the kid right now. And suddenly the OR nurse, the surgeon, me, the scrub tech, the people in and out of the ORs who help us, their mindset is just way more for the kid orientated. So it makes for me at least, a better working environment. And I just like working with kids, man. They scare the living bejeebies out of me. You have a little kid, not as big as his glass, 900 grams, and he's his little messed up heart, and he's coming for a must-have surgery right now, and you like have to download all this massive amount of information on this kid and like get them safely through the surgery. Makes like right now my heart rate's going up just talking about it.
My heart rate's going up listening to you talk about it.
I'm like,
But one of the things that's so interesting is that, like, with adults have this thing about like, okay, you're a doctor, you've been through medical school. I guess I trust you maybe because you're a doctor. Like, there's that implicit knowledge. But with kids, like, you don't have, like, you have, I assume, like a few minutes to get some kids' trust before you stick them with something and put them to sleep. Like, how do you do that?
the same thing with the parents. Like,
Or
they're
am I
about to
visualizing
give you,
that wrong?
yeah, that kid is scared out of his, depending on his developmental age, is scared. There are some kids who walks in and is like, just do your thing, man, and remember to check the suction. And oh, by the way, don't be on your phone while you're giving me anesthesia. You get some kids like that. But most kids are just scared. This is strange to them. Very little you can do to a dad joke goes a long way, but a lot of it has got to do with trust. Like, get the parents who trust you. A lot of the stuff we do on kids is like a little bit of I have to do this thing right now. It's not very elective. So the parents are inclined to need to trust you. But man, what a leap from this little bundle that you've been taking care of. I'm going to give it to you. I've just met you. I don't know anything about you. Please don't let him die. That's literally on the forefront of the mother's brain. And she superstitiously, or like, she doesn't want to invoke the universe to say that aloud, but that's what she wants to say. Don't kill my kid. Just bring him back to me the way I gave him to you. It's a bit of a trick. And I miss it sometimes. Like, most days I'm like casual. I walk into the room, meet the family. I tend to be casual with them. I tell a couple of jokes.
Do you have a favorite dad joke that you like to deliver here?
You're putting me on the spot. Let me think about that.
You can come back to it later.
I have a couple, but tell a couple of jokes, and for the most part, you bring the temperature in the room down, and obviously read the room. Sometimes that's just not the case, but and now and then I miss a mark. Now and then I upset a mom beyond words. You just do. Like, at least once a month, I've upset someone or missed, and then you have to walk it back and apologize and swallow your pride. But for the most part, it's such a rewarding thing, like giving a baby back to a mom and saying everything went fine.
When you say upset them, it's like because you're trying to add levity to a situation, or because
okay. So there's so many ways to step in it, right? I take care of multiple different cultures. There's an implicit distrust of doctors because we are traditionally paternalistic. Not anymore. I think we're much better about it. But, and then you've had a bad experience, right? Some moms come in, they've been in and out of this. Someone really fudged it. They fucked it up with a kid, and you're the next guy, and she's waiting to hear you say the same thing that was the wrong thing last time. So there's some of that. And now and then they just don't appreciate the levity. Like they're like, you need to be as serious as this situation is. And then I quickly walk it back and like join. But for the most part, about I would say 90% of the time, the parents really appreciate just. And the same thing we talked about earlier. Through all the joking, the reason moms trust me is I make sure to pepper in ways that I know your kid. I looked at him up. I know the details, and also I know what the fuck I'm doing.
Yeah.
I'm not with no ego. I look mom in the eye and go like, I'm really good at this. Your kid's gonna be fine.
How much of
And
this
they
were you
appreciate that.
prepared for? Like, does medical school teach you how to do this kind of bedside stuff, or is this a figure it out on the job kind of thing?
Both. They know that we are actually pretty bad, man. We're so bad at patient interactions. Like there's thousands of stories about the way a doctor didn't listen to a patient, or they like kind of belittled his opinion, or they like dismissed him or her. They misgendered him. They stepped in it in so many wrong ways. So we practice that now today from day one. And some of us are a little autistic. I'm definitely a little ADHD, a little autistic. So now and then we're like, hey, the mom's only fear is, am I going to be in pain, or my kid going to be in pain? And I'm like, yeah, your kid's going to get a knife. Of course he's going to be in pain. So having to hold that in takes some practice.
Yeah,
Um,
I can imagine.
and yeah, so we practice it all the time. And then some of it is trial and error. I would have someone for my entire training as a fellow. Every time I had a patient interaction, I would have an attending with me or a consultant with me who would, after the interaction, actually nitpick me. Like, you said this, that's not the best verbiage. Hey, you phrase it like this, stay away from that. You missed this following. I get like pumped, like every single time.
Did you find that helpful, or was that like, this is irritating?
Actually very helpful.
Okay.
No, actually very helpful. I ended up modeling the way I speak to patients after a older colleague of mine. He's not much older, but he's the kind of guy that you call when things are on fire. And he's the kind of guy that says yes to taking care of a mom that no one wants to take care of because she's just really tough to deal with, or impossible to please, or just asshole. He's a mommy whisperer. So I got lucky that he was one of my mentors, and I kind of modeled my way around what he does, and it's been successful.
When you kind of go through these things, are you like checking yourself at each step of the way, or are you just like, yeah, I've done this a bunch of times, it's okay? Like, how do you talk to the people as you're explaining to them that everything's actually going to be fine?
You want to read the room, and like I said, I get it wrong often.
Yeah.
And the more I do it, the more humble I become about it. I'm like, I get it wrong probably way more than people tell me. But you are meeting, I remind myself every single time, I'm meeting someone at their most fragile moment, or their most scared moment, or their worst moment. Like, this is just the worst moment of their life. And meeting them right there and being a human with them. Like, you gotta be good at your job, but when you meet people, you gotta be a human. The amount of times I break out in tears when I tell a mom, hey, this is gonna be okay, it's about once a week, man. And I think
That's really beautiful, actually, to like be able to be human in that moment when you need to be focused and professional.
yeah. And again, now, once in a while that misfires, but for the most part, when you look a mom in the eye, I'm like, hey, this sucks, man. And she can see that you actually mean it and feel that you mean it because like you mean it.
Yeah.
That goes a long way. And that's part of knowing what you're doing. Like, just so my line is, and I truly mean it, when I take your baby back to the OR, I'm going to take care of your baby like he's my own kid. And I mean it so much.
That's so intense.
It is the best. And I must say, having my own children made a big difference. Before kids, I would have moms oftentimes go, "Oh, you're not a parent yet, are you?" Like they just know. Like something you just said, the way your way about it, way about going, they just know you're not a parent. And the moment you have a kid, and my kid had surgery surgery in the first couple of weeks of life, and I had to like ask a buddy to please take care of him, and then I'm like on the computer watching them do it, which I shouldn't have done, but I did. My wife's a nervous wreck, and they missed.
Why should you not have done that?
It's not a good idea. You shouldn't. You should be a patient in that moment.
Okay.
But what I saw, and I shut down the computer immediately, was that they missed putting a breathing tube in my baby 3 times. It is it's a big deal. It's my CRNA, Sherelle, is a more experienced nurse and anesthetist, and my colleague Steph Black, who I specifically chose because she's like this. I'm gonna butcher her height, but she's short, and she's a redhead, and she's fiery in the sense that if a surgeon is like being an asshole and no one's listening or things are going down and the room is not focused on this, she will make them focus. So that's why I asked her. And these two are world-class anesthesiologists, and they still missed my kid's airway 3 times, and that's when you kill a kid. And I'm like, just shut down the computer because I'm like, I can't tell my wife this; she's going to lose her mind. She's like, nope. She's like, what happened? Like, no idea. Not a clue. But having kids definitely helps with the job.
Did you become more comfortable as a result of that? Or were you, I guess the question is, at what point did you become comfortable with the fact that you had the lives of children in your hands, or are you not?
I think the answer is being comfortable with being uncomfortable. I think that's how you grow. You never become uncomfortable. I took care of a baby yesterday who's got a really messed up heart. And there's this one thing that happens to the heart that is everything you traditionally would do to save the baby is wrong. And you would have to identify it and do opposite stuff to save him. And I couldn't sleep the night before. And this is my 6th year going into this, and I've been a doc since 2007. So even though I've done some wild stuff and saved some people in the wildest scenarios and done some really crazy stuff, like I assume you might have done in the army or in the service, and that's just an assumption, but I mean a fair assumption, right?
I mean, I have done some crazy stuff, to be honest.
Exactly.
But I feel like the kind of crazy stuff I did is not at all the same as the kind of crazy stuff that you're talking about.
It's the kind of stuff that makes your heart rate go as high as it can go, right?
Yeah, okay,
And
that
makes
I've
your
done,
nervous
yes.
and makes your nervous system light up in a way that nothing else can, right? And it
Yeah.
like sticks with you, like a cup of coffee reminds you that you go back to that like immediately. I talked about speaking to kids, and I got emotional about it. But so it's a case of getting comfortable with being uncomfortable and reminding yourself every day that this is not routine. And then we have little reminders. Like you have a routine quiet day, and you like just the joke is that we anesthesiologists just sit there and look at their stocks or play Sudoku, and then out of nowhere, this kid has this spasm in his heart, and he's fine, and he's literally, without exaggeration, dying in front of you and about to like die in a way that you can't bring him back. And you just have to deal with it. And those little moments remind you brings you right back to attention. Like, hey, this is real shit.
What was your like holy shit moment? What was your like I cannot believe somebody is trusting me with the life of this their most important human kind of a moment? Or
Um, so, there's many of those, but probably I go back to the first day as an attending. Like all of us have our first, we're a trainee, and then there's this line, and then now you're blessed and go. And my first day as an attending, I'm I'm covering a room with my colleague Sherelle, the nurse anesthetist, and my boss comes up to me. He's like, "Hey, there's this little baby who needs a tether, like a cord released." And I'm like, and by the way, he's got a fixed heart lesion. I'm like, that's a really, and I remember saying this to my boss. I'm like, that's a really big person case. And he puts his hand on my shoulders, like, "Yep, don't fuck it up. Good luck." And he specifically said, "Yep, don't fuck it up. You can do this." That's what he said. And I shat my pants the whole way through. And Sorel, my nurse anesthetist, knew that, and that's why I'm with her. She like guided me through. Like, I remember this, remember that, and um, that was the first. Oh my God, this is real. And the second, oh my God, this was real, was the first time I lost a patient's airway. And what that means is I induced you, I made you fall asleep, and before I gave you my drugs, you were breathing, and now you're not. And I can't place an airway in you. And all the things I know how to do is not working. And I'm escalating to the next step, to the next step, to the next step, and having to call two friends to come help, and they not help managing it as well. And I'm watching this kid die in front of me, and we can't get it. And this, praise God, this older, 50s anesthesiologist, Anna Corsina, comes in and just pops the airway in and walks out as if nothing happened. I'm like, and then having to that, and that's real. Like things get real quickly. And that, I would say those are my two oh fuck moments. And then,
that's so intense. Like I sort of expected some of this stuff, but just I think there's a level of intensity seeing you and hearing you talk about it that kind of you deliver it with intensity, not in
oh
a
yeah,
this
I'm a little emotional talking about this at the moment, to be honest.
that I'm
Um,
not surprised. I'm actually quite
yeah,
impressed that you're like still holding it together. I feel like I'm getting emotional listening to this, and I'm kind of
yeah,
surprised. Like it, I mean, one of the things that's interesting to me about doctors is that most doctors that I know who do the kind of things that you're doing, they feel like it gives them they have that sense of purpose.
yeah.
Did you do it for the sense of purpose, or did you sort of find your purpose as a result of doing the work?
Um, I've always wanted to be a doc. And in South Africa and most of the Commonwealth, we go into medical school right out of high school. So you're signing up for this job and for this thing. You've got no idea, right? You're saying, I really want to do this as a high school kid, and you've got no idea what you're saying yes to. And a lot of us, if you're like kind of good with people and you got good grades and you express an interest in this, you've some person in high school, some guidance counselor is going to kind of lead you to this. Um, I've no one in my family other than my cousin who lives far away, who's a heart surgeon. No one in my immediate family who are docs. So I always just wanted to do it. But in hindsight, I'm like, I had no idea what I was signing up for. And I just got lucky that I liked it. Like really lucky that I liked it. I've oftentimes been in the operating room or the ER going, holy shit, what a privilege, right? I'm doing exactly what I thought I wanted to do. And I am stressed. What a privilege to be this stressed. I'm living exactly the life I thought I wanted to live. And I happen to also like it. And that last part is lucky as fuck, I think.
I
Because
agree.
man, I could have hated this. And I would have had to make big changes after big decisions. And I've got friends and colleagues who had to do that. But I think I got really just lucky that this is what I wanted to do. This is what I got to do. Someone gave me a thumbs up, and I'm just lucky to do it. I will tell you, I was the last kid into medical school. Like literally, my grades weren't that good. By the time I had to take exams that were like high fidelity exams to get into medical school, I had a pretty volatile home environment, and probably also a undiagnosed ADHD. So between those two things, my focus wasn't good. I studied a lot, but I didn't get a lot done.
Yeah.
And I was lucky that under pressure of like, if you don't pass this exam or do well right now, when your adrenaline spikes, I performed. The ADHD superpower, I think.
Hyperfocus is sometimes a really valuable tool.
It's a superpower, definitely is. But so
When it
anyway,
works to your advantage, I agree.
Yeah, I didn't definitely, especially in the OR when things go down. I always get the question, how did you manage to stay that calm? And the answer always is, I think, just the way I got wired. Nothing I'm doing myself.
Yeah.
It's just ADHD and the wiring. But anyway, to answer your question, I got into medical school really late because I didn't tick all the boxes. I really wanted to do it. The admissions office really knew how much I wanted to do it. My dad and I stood in front of this admissions lady, like, please, I'm begging you, please get us in. What can we do? Please, there must be a spot for us. And there just wasn't. So I was sitting in a psych class when I got a phone call from this admissions lady, like, hey, there's this kid who didn't pitch. We've got this one seat. We can't get a hold of anyone else. Kind of on my list. She literally said that you're kind of on my list. Do you still want to come? And I packed my stuff that night and I started medical school 2 months late the next morning. And the only thing I did during medical school was that I never failed a class. Never did well, but I never failed a class. And I performed as best as I could for what I was given with my brain. But then I got lucky. I got into this job that I happened to be good at, and I got lucky. Like all of us, right? I think
that's a great thing to have happen to you, right? Not everybody gets to be lucky and enjoy the work they do, and you get that.
True.
I have like one other or two other very specific questions that might be like more relevant to the United States, but I just am like genuinely curious about how do you deal with specific situations where you're unsure about how to ask a question to a patient who might be in pain, who might be struggling, and they're maybe not giving you the real answer, but you can't be more direct because of like potential malpractice or like there's that kind of balance. Like, how do you deal with that to try to get the information that you need?
I think when I walk into a room, I've learned that I have to put aside my natural inclination to think I know what's happening. I walk into a room often and I have to like stifle that. Like I don't get the whole picture. And I remind myself that as a practice habit. I don't understand everything that's going on here. And then conveying that to the patient, like I genuinely don't know where you're at right now. I don't have the tools or lived experience to know where you're at right now. And I think meeting someone there is a great start. Then there's oftentimes something as simple as a language barrier, specific in the States. And we have amazing tools right now where we can get an interpreter to come help us out or an online interpreter. So from checking that box that you're not getting stuck up on something as simple as a language barrier. And then the cultural barriers are obviously harder. I'm a 6-foot white dude from South Africa with a pretty racist past. Or if you don't know that about me, I'm a 6-foot white dude with an accent and a set of glasses. So there's some.
You mean South
biases.
Africa has a racist past, not you?
Yeah. Yeah,
Okay.
well, obviously, but yeah, South Africa has a very noted South Africa.
Yes.
uh, racist past, and I'm the face of that, right?
Yeah.
So making sure that I at least acknowledge that part of it, or that potential part of the miscommunication. And then if I if you and I really end up not understanding each other, and I think it's as simple as uh, what I just said and what came back at me, those two things didn't line up. That has to be like a big old flag for, hey, there's a miscommunication. I think that's when you call in a buddy. Like I have a couple of colleagues who are way better spoken, not just in what comes out of their mouths, but in the way they understand what is being said to them. And I would oftentimes lean on them to come help out.
But you're talking
Does that answer
about
your question?
sort of. I mean, there's two parts to the question. You answered one of the parts, which is, like when you're struggling, but like the other part that you didn't quite answer is like, sometimes you need to be like, hey, asshole, you're not giving me the answers I need to help you, but you can't say that. So like, that's part of it, because like, you don't want to get malpractice, like, something there. Like, how do you deal with those like really difficult situations? Is that when you call, phone a friend?
That's definitely when you phone a friend, or at least have a friend with you.
Yeah.
And I think in the ICU setting, or in a we need you to say yes to A, but we need you to say yes to that, or at least tell us. We would often have a group of people to talk together, and someone would guide this conversation. And that in those numbers, there's a lot of safety in that. If someone comes back from a malpractice point of view and say, hey, you this, this, and this, there's a group of people who go, like, actually, that's not what happened at all. Or even if you, with your permission, we'll record it so we can all dissect it afterwards.
But also, how does that happen with kids? Like when you've got a child there and you're trying to get how they're feeling, or what level of, or if they even can communicate with you.
It's hard. And this is, I'll probably get butchered by the community for this, but a little bit, when there's a point where kids can't talk to you, where it's a lot more veterinary sciences than medicine in this traditional sense. You're like you're dealing with a little mammal who can't speak, and you have to like guess what's
Yeah.
wrong.
That's kind of why I was asking.
Yeah. And then there's a little bit of trial and error. And I think communicating, like making sure that mom and dad understand that I just don't have the answers. I think we might get to some of the answers, and we have to do this, hold our hands together here. That's the thing. The biggest thing in the States is your a la carte medicine, right? That was my biggest culture shock when I came here. It's like, hey, this is the best med for you. And you would go, no, I don't want to do that. Then I have to honor that. That's very much the difference between in other industrial countries where it's a little bit nationalized healthcare, and here where it's very much like a pro-choice and pro-person. Like, I'm just not doing that. Thank you for the advice, but I'm just not going to do that. So we are going to do this in a different way. And I think about our friends there are communities who do not like to get blood. They were with a straight face. I'm like, hey, your baby's about to get a massive surgery and will lose blood, will need blood. Can we please give him blood? And they will go, no. I'm like, it could kill your child. And they will literally go, yep, you will find a way to do that without this. And we do. We get very innovative and creative with it. And we try and cater to the patient and the family's needs and cultures as best as we can.
That must be
But
infuriating.
but I think practicing with the malpractice in mind, I think when it comes to text messages and social media, you always have to think malpractice. So just keep your job off social media, specifically with controversial topics, or talking about a specific identifiable patient. Then you think malpractice, but for the rest of my job, you just think, what is it best for this patient? And I think that as a guiding principle, I don't think malpractice every day. I think what is best for this kid. Does that answer your question?
Yeah, that was it. I really was just kind of trying to wrap my head around like how, I mean, I have a job where I manage people and I understand that communication is very difficult, but I work in, software capitalism, right? Like the stakes are high, but not like what you're doing. And so a miscommunication is like, oh, that feature didn't go out that day or something. But your miscommunication is, oh, this person might not survive. And that's assuming the person can communicate, right? Because sometimes you've got kids who can't. And so my question was like, how do you end up dealing with these situations where there are just people who literally can't communicate effectively and their life or their child's life depends on it? And how do you sort of shield yourself from the litigious machine that sometimes comes with that? You answered it. That was the gist of the question.
And when if I think about a mistake like that, if I think of a scenario where, say, the patient really, something simpler where the patient really cannot afford to have like an IV in one arm because they have a fistula placed there. They've got a surgical communication between the artery and their vein. And we made that on purpose so that we can use that to give you dialysis, as an example. So that becomes like this very precious limb for the patient. And the parents just don't want you to place an IV there when you do like a surgery. And if you miss that, we have all these checks and balances, but sometimes I can think of a time where I missed that and I placed an IV in that specific arm. And the mother was furious and ready to like bite my head off. That's when you put and we get coached in doing it because I think and it's also the right thing to do. That's when I walk into the room and I say, I'm fucking sorry. Like and then she's like, why did this happen? I'm like, I fucked up. I'm sorry. And then the traditional thinking is like, don't admit to fault, because that's our problem, right? That's why there's so many lawyers and so many marriage counselors. I think HR, marriage counselors, and lawyers are an indictment of how immature we are, and that we all think we're mature, but we're not. We're not unable to say I fucked up. I'm sorry. Like really say it without adding a but. And walking in and telling that mother, the specific mother, hey, I fucked up. And she's like, you will never touch my kid again. And that's true. I never touched a kid again, but I also didn't get sued because I went, I'm sorry. And she went, I accept that.
I think you got lucky, but it's, I mean, I know this is not the same level, but like
it actually remarkably goes a long way. It's not just luck. It actually remarkably goes a long way. People are, for the most part, not just looking to get a check. They are really just making sure that you just don't. There are definitely predatory lawsuits, and they're definitely like lawsuits that need to happen on the other end of that. But for the most part, people are just interested in.
I didn't think that somebody would be like looking for a check as much as you messed up on somebody that I care about and I'm going to make you pay. It's not even about like it's more like a revenge or vindictive thing than it is an interested in money thing.
Yeah, it's a little. There's definitely both, but I can't speak to it too much. But there's definitely both of that. Like, you messed up, we need to hold you accountable. I agree with that part of the system. But there's definitely also, you messed up. Aha. There's a little bit of that too. And you just have to be outside in Philadelphia. There's like malpractice billboards up and down the state. There's like literally companies fall over themselves to advertise themselves for malpractice.
Yeah, I imagine. I mean, you also teach, right? So how much of this do you try to convey to the students?
I'm not an expert in the malpractice part of it. There's definitely
no, not the malpractice stuff, just all of the things that we talked about around how you talk to people and how you function and the realities of the day-to-day that you do.
It's definitely like a progressive apprenticeship. Because we have these two like when it comes to students, I've got multiple types of students. I've got fellows who are anesthesiologists who are coming to learn how to do pediatric cases. and they come for 1 or 2 or 3 years, mostly just 1. And then I have residents who are coming to learn about pediatrics as part of their global training. And then I have medical students, and then people who want to get into medical school, and then all kinds of emergency medicine doctors, intensivists, who come to me to learn how to do airway stuff, like how to rescue a patient's airway in an emergency. And remind me to tell you one of the most rewarding moments like that I've had. But when it comes to teaching, we have to teach these guys what we do and how to do the job while also keeping the day going. Because ultimately, in the States, it's a bit of complex. It's a bit of a business in the sense that we've got 100 cases to do today. We got to get it done on time. And while we at an academic institution definitely respect and stop and slow down for education on all aspects, we definitely have to keep on going. So it's a progressive apprenticeship where you're with me, just get comfortable in your OR. Yeah, you can give this drug, see what happens. Hey, you do just hold this mask and see if you can get air into the lungs. And so we go. And the same thing with speaking to patients. Come along, just hear what I'm saying today. Don't say anything. Introduce yourself today. How about you do this part of the conversation? And so we go. It takes 4, 5, 6, 7 years. They do undergrad, which is just base, and then they do the medical school for 4 years, and then they come graduate training, which is 4, 5, 6, 7 more years. So it's like a 12-year apprenticeship, I think. And it's slowly introducing you to the parts of the job I do every day.
Why did you get into the teaching side of it? Because not everybody who does these things teaches.
Easy answer. Most of the big pediatric centers where we do the big cases are attached to a university. So Children's Hospital of Philadelphia is attached to the University of Pennsylvania. And my contract is literally written like that. I'll do 90% clinical work and 10% teaching. And how I do that is different. I teach a couple of classes to fellows, a couple of classes to residents. And then every day we just have every 4 months or every 2 months, we have this group of kids who come through and they're just in your OR with you and you're going to teach them what you do. And same as I said earlier, just got lucky. I liked it. I thought I'm going to be like a CEO or a division chief or a chair. And I think I have shifted more to naturally teaching. And that's paid off way more dividends. I enjoy that so much more. I have a guy call me. He was a ER resident. He spent 2 days with me and I ran him through like different kinds of intubations. You can teach a monkey how to do an intubation, like put a breathing tube through vocal cords, but doing it well and doing it in the right scenario and doing it when it's hard, it's all a different thing. Doing it when someone's screaming at you or blood coming back at you, different thing. Or someone's shot in the face and they don't have a mouth. But this guy calls me and it's like, hey,
I just like to point out how flippantly you said that. And like how somebody shot in the face and had no. I used to. One of my exes was a head and neck surgeon and worked in the ER, and she also very occasionally, very flippantly was like, "Yeah, so this person got stabbed, and I had to first close up the throat before we could intubate them correctly." And I was like, the fact that you just throw that around like that's a normal thing. You can keep telling the story. I just think it was very funny. You're like, oh, they shot in the face. They have no mouth. And then you kept going.
We're in Philadelphia. I worked in South Africa. I worked in Edendale, in the Peter Maritzburg complex where we saw a lot of trauma. And in fact, I was there during a period where the Zulus and the Xhosas were fighting each other. They had a little mini civil war in Durban. So we saw an absurd amount of trauma. And then I came to the States and I trained at Temple in North Philadelphia. And I'm like, this is the same. The amount of I currently have my finger in someone's ventricle. They've cracked open his chest. There's a big old hole in his heart, and the surgeon is yelling at me, just, I'm the resident, put your finger in there. And I've got my finger in the hole, like literally on all fours, trolleying to the OR as they're getting ready to like pump this guy full of blood and close that hole as best as they can around my finger. And then I put my finger out and they keep on going. Um, and the amount of trauma I saw in at like it became routine is my point. Like we would for my whole anesthesia residency at Temple, every time I was on call at night, I didn't sleep. We just did traumas. You would be a second year, first year, third year, fourth year resident, just doing a trauma while your attending is taking care of a liver transplant in the other room. And you just, it's wild. And so we got pretty good training for that. I would say the wildest airway I've done was a guy shotgun to the face. Various kind of distinguishing, like difficult to distinguish as what, still breathing, and we have to secure an airway, and we couldn't identify anatomy, where I ended up going
Was
the
it
other way
like
around.
buckshot, where there was just like a bunch of like little small holes all over the place?
No, he had pretty significant tissue damage. Like, he's like flaps of tissue was just, and pieces of like, but he was still awake and he was still breathing. And I ended up putting a needle through his cricoid membrane here and putting a wire up until I saw it in the bubbling blood coming out of the mouth, and using that as a guide wire to put the tube through the vocal cords and then putting it in, which is something we in theory learn to do but never get to do. While I was doing this, I'm like, holy fuck. And again, you're lucky that it worked. This guy, he's ended up being alive, and he got a lot of reconstructive surgery and stuff. While doing it, I'm like, oh God, what the fuck?
That's amazing.
Yeah.
I feel like
lots of different.
I feel like not everybody understands that. I mean, obviously this is not like every doctor has this, but the fact that you've done this enough times and been through enough of these traumas, like that this is just like, oh yeah, I got to do this. Like it's pretty incredible.
I mean, yeah, my wife's an ER doc. She does this almost every time she goes to work, this kind of crazy stuff. And sometimes it's like cowboy medicine like that, where you just have to do whatever you have to do. And sometimes the craziness is walking a tightrope of, I take care of a population of patients where if you touch their jaw or their muscles anywhere in their body wrong, it turns into stone. Like the tissue turns into bone. And so the implications of that is, if I do all the normal things to you that I would do to any other patient, to you can't eat again. Your jaw will close and you'll never be able to eat again in your life. So now you're coming for a surgery and I have to put this airway in you. And if I move things the wrong way, you don't eat again, or you die because you can't breathe. So you're walking this tightrope where you like literally everything has to go precisely, perfectly, for the next thing to go precisely perfectly for me to get this airway in safely so we can do your surgery and then walk it back so that you can eat afterwards. So there's a lot of that too. The trauma stuff is definitely less now in my job. And luckily in pediatrics, we don't see it as much as I used to as a trainee.
I mean, wow, first of all, but do you prefer this, or do you like the trauma more, or do you want a calmer life?
I definitely enjoyed trauma a lot. I like being in the ER. I was never as good a ER doc as I think my wife is, or like guys who are like super consultants in emergency medicine, like specialized emergency medicine. I don't think I've ever been that good. I was just the young guy working in that environment, doing what was asked of us to do. So my wife was definitely like a specialist in this stuff. I'm no longer, and I wouldn't call myself that at all. But to answer your question, yes, I like pediatrics a lot more. There's enough stuff to that make my heart rate go up every day. But I don't need to deal with knife wounds and gunshots and open chests and stuff. And I don't need to do that again. I feel like I've done my share, and I don't need, like you can tell, like this has taken you to some emotional place, and this has taken me to some emotional place.
It is.
I don't need that anymore. Like I'm okay.
That's totally fair. Well, now I want to hear the story that you were going to tell before.
Oh yeah. As far as teaching, it's very cool to see my fellows come. I've also like been growing as a teacher. Like I was, and all of us, we get terrible teaching scores in the beginning of our as attendings, and it gets a little better when you become a little more polished. And it's so easy to offend a learner, right? Especially these learners, they know what they're doing when they come to you. They're already educated, and they're coming for finishing school, and you're still learning yourself. So you're not supposed to be the guy that helps them refine their skills while still learning. And that's not lost upon the learner and the teacher, that there's a little bit of I know that you're doing this for the first time too. So there's a little bit of respect back and forth in that way, that you are a high fidelity learner. But one of my most satisfying moments as a teacher was someone calling me, asking, just want to bounce an idea off me. And he identifies himself as a intensivist, and he's about to intubate this patient, and he just wanted to know what I thought about his plan. It's a common thing we do. I call a buddy all the time, like, hey, what do you think? What do you think of my plan? And he would go, sounds fine, or that's terrible. So he calls me and talks me through it, and I'm like, sounds fine. Think about this and this as well. And then at the end of the conversation, he goes, oh, by the way, I don't know if you remember me, but I was a ER resident coming up to you when you were a first year attending, and you spent like a couple of days showing me how to do this and like making it finer for me. And I'm about to do exactly what you showed me 4 years ago for the first time since you showed me. Thank you. And we have a community of stories like that. A colleague of mine had a intensivist caller before he was about to intubate her dad. And she's like, hey, just so you know, I'm about to intubate your dad. I just wanted to let you know, you're also the one who showed me how to do this. And that little human connection in the teaching is, I think, pretty magical.
I mean, this is all like really intense stuff. I feel like it's surprising to me almost how normal this is for you. Not that I wouldn't expect it, but like the fact that you live at this intensity level on a day-to-day basis. I mean, not that it's like every single day, but the fact that you...
Some days you get to work and you're taking care of a 18-year-old lacrosse player who is the fittest, healthiest patient in the world. She falls asleep without any anxiety. She's like, makes a joke as she falls asleep. We fix up her knee. I do all day of that. No heart rate spike, no dramas, high fives at the end for everyone. I've got lots of days like that too, which is just like, yeah,
that's a good thing.
It's not crazy the whole time.
No, I wouldn't imagine. I'm also curious, like, what in this new age of AI, like, how does that kind of impact the way you teach? Because there's so much more information that's accessible in a fast way, and it has to be checked in a different way. Does it make for more difficult teaching? Are students more challenging? Does it make it easier overall?
So AI is fascinating. It's not something I think I understand even a little bit. I think
most people don't. I just happen to work with it, so I understand it quite well.
Yeah, I mean, let's please talk about that. But the way I have AI is, we definitely have students, fellows, learners use AI to put together an email, put together a talk, whatever. But what we've seen is there's no knowledge retention. If anything, the internet showed us is like lack of knowledge wasn't the reason people are stupid.
Yeah.
We're like, hey, here you go. You've got all the knowledge. You've got all the encyclopedias ever thought up right there. That's not why humans can't do stuff. That's not why we are a dumb as a collective. So more knowledge, at your fingertips, I think. Is what I know is that when students, we see that with our medical students, when they put together a talk or a paper using AI, there was no learning there. And the reason for you to put this paper together is to go sit with this a little bit, mull it over a little bit, put it in words a little bit, like assimilate it for yourself a little bit, break it down for yourself a little bit. So I think AI as a teaching tool, maybe not the best. AI in my workplace is kind of cool in that we have this electronic health record where we're now integrating AI where it can. It's pretty modular in the sense it can summarize something for me nicely. I'm
Yeah.
like, hey,
Do you
can
guys
you
use
please?
Epic, or which is the health
We
system?
use Epic.
Yeah, the Epic's doing some pretty cool stuff with AI. They're probably one of the more advanced health systems. Like they're doing a
Yeah,
little bit more than Cerna. They're doing a little bit more than like,
it,
some
it's pretty
PCC and stuff.
it's pretty cool. Have you ever been to the Epic campus?
No, no.
It's if you gave a bunch of really smart nerds an unlimited amount of money, and then they could do with a campus that they want to. Epic. They have like they without breaking us like a smile. They would like take you into an office that's got a hobbit door for a meeting. They have dragons and wizards and whole different worlds on their campus.
That's cool.
It's super cool. But to answer your question with AI, I think it's really helpful in that it's got a couple of guardrails, like it puts up some guardrails, all the reminders for you, like, hey, you're about to do this thing. Just remember, tick, tick, tick. Hey, you just gave this drug. You don't typically give this. Is that what you wanted to do? So, as long as for me, my take on it, as long as AI is a tool and not a electronic overlord that tells me what I can and cannot do, happy as a clam to have it around. But the fear is that it's going to become this thing that says, hey, hard stop, you can't do what you were supposed to do.
Maybe. I don't know if that's it. I think there's a really interesting sort of situation right now where we're trying to use a tool as something that's not a tool. And I think as long as we continue to use it as a tool and it interfaces with us as a tool, it's like your hammer's never going to tell you don't hit the nail like that, right? It's dumb. But you're working with something that's like, by your example, hey, you don't usually give this medicine, or you don't give this medicine in this dosage. Are you sure that this was your intention? Like,
Yeah.
that is useful as a tool, as long as it's not stopping you from doing the thing that you think you need to do.
Yeah.
There's a level of like trust in the equipment, so to speak. And it is a piece of equipment, at least for now.
Yeah, I hope so. Like I said, I know nothing about AI. For me, it evokes Sarah Connor and
Yeah,
I'm
Terminator
going to
type
become
stuff.
I'm going to become a battery in the Matrix. That's the kind of stuff we're fearful about, right?
Yeah, I think I don't think we're anywhere near that. But what I do like about AI is that if you use it in an intelligent way, it's very helpful. Like oftentimes I'm like, I don't know anything about this topic. Tell me about it, and that's kind of useful. Except if it just tells me about the topic, that's not helpful unless I have structure for it, right? And that's one of the things that humans are really good at, is building on top of existing structures. And so if I say, as a CTO of 20 years, tell me about this new topic that has nothing to do with me being a CTO, but through the lens of things that I would understand, then it becomes an incredibly valuable tool that can speak to me in the language that I need to be spoken to in order to integrate the information in a way that's good for me, right? And like, that's the way that I think people aren't bridging the gap for how they can use it. Like if part of prep for our conversation for me was like, hey, as somebody who manages people for a living, like, explain to me these concepts that an anesthesiologist might have to deal with. And I was like, oh, okay, this is helpful. Now I understand this.
I mean, that's kind of magic that I can do that.
It is.
Like you in the past would have needed a translational engineer.
Yeah.
They can, like you said, can bridge the gap between my language and engineering language or coding language. And the guy and the manager in the middle is the guy that like used to like, hey, this is what you're saying. And
Yeah.
that's, and the fact that it can do that, I'm like, it's mind boggling.
Yeah.
How, so that is actually a good segue. CTO is Chief Technical Officer,
Yeah. Chief
right?
Technology Officer. Yep.
Technology Officer.
Yeah.
What technology are you working with?
I work with a lot of different stuff. I have a team that focuses on like computer vision and recommendation models for how, like, what the best piece of clothing is going to be if you're a retailer. I have a team that focuses on analytics, like web analytics, mobile analytics, email analytics. And then I have a team that focuses on workflow automation. So if somebody uses the analytics and says, "Oh, you've added something to your cart and you've abandoned cart, or you've added this item to your wish list," we can reach out and say, "Do you still want to? Are you sure you want to abandon that cart?" And then we can check how successful that was by looking at the analytics, and
The
we
amount of
can,
things I've bought from the reminders like that.
yeah.
Mind
That's why I said earlier, I work in capitalism, and it pays very well, but at the end of the day, I'm not saving lives. I'm just a cog in the financial capitalist wheel. But I get to do
I mean, you
things that
can
I
get
find very
you can
interesting.
you can get real meta about that, right? What are you overseeing? 100, 200 people?
Yeah,
Like
about
you have 3
200
teams.
people. I have about 200 people on my team.
You are managing the fears and hopes and lives of 200 humans.
Yeah, I don't take that for granted either.
Yeah, and in the sense that like all of us find some form of the idea that we have to be fulfilled by our jobs. Like I'm lucky, I know I am, but the idea that we have to be fulfilled by our jobs the same way as we are a little bit have to be completely fulfilled by a marriage is brand new, right? That stuff is like industrial revolution on new. Before that, you got married for ground, or before that, you were a Thatcher. Your dad was a Thatcher. You become a Thatcher, or the guy in the sky or the king said this is your position in life. And there's something freeing about that. Now we get to choose what we want to be, and we are like, if you choose well, and you should also be happy, and if you're unhappy, it's because you made the choice as well. I'm like, we're kind of hard on ourselves, I think.
Yeah.
But ultimately, you have got 200 people with these hopes and dreams and aspirations who go about their lives, and you have a vital, important role, not just for what you do for yourself, but for these guys. I think there's a lot to be said about that. And
I actually agree with that, by the way.
if the capitalism stops working, these hopes, dreams, and lives goes away. Yeah,
Yeah,
in many ways, we have people's lives in your hand as well.
in some ways, yes, I agree with you. But and also, I find myself very lucky because I genuinely enjoy what I get to do.
I can
I
tell.
don't love the capitalist part of it, but I do love getting to help people be better at what they do on their day to day. I do love teaching people how to, be better managers, leaders, communicators, like structure their days, like just things that I happen to have skills at. Um, and I'm lucky in that I find purpose in helping people be better. And that's actually what I get to do a lot of. I get to do it at work. I do executive coaching. I get to teach jujitsu and help people be better. Like, I have found that purpose in that way, but I'm also not unaware that yes, capitalism helps pay the bills for people. But at the end of the day, if somebody doesn't get the exact perfect, recommendation for it's like, you'll get
Yeah,
the next one,
fair enough.
like
Fair enough.
I try to be very practical about it, but I do feel very fortunate that I love what I get to do on a day-to-day basis.
The day I enjoyed, like, I get it. We have to be very suspicious of capitalism. Like, in many ways, the evils of the bottom line and the evils of smearing over stuff for a profit. Like we've got billions of examples like that.
For sure.
But the day I personally enjoyed capitalism was when I got to sit in a was it Qatar Airlines Q suite, where this on the plane where I had a customized champagne-based whiskey cocktail brought to me. I'm like, that for that 8-hour flight, I really enjoyed capitalism, I must tell you.
I
For a
enjoy
hot
it
second.
too, but I enjoy it mostly because I get the benefits of it, right? And I'm not
Yeah.
on the poorer
Yeah.
side of it, as many are unfortunately. But I just happen to like the thing. I happen to like the part of capitalism that I get to work with. I happen to like working with people. And if you had told me 15 years ago, when I, started my first company, that I was going to like managing people, I'd be like, I don't know who that fucking guy is. But I genuinely enjoy it now. And, I don't love every single thing I get to do every day, but I like most of it. And I feel like I'm very lucky in the sense that, liking 85-90% of what I do in a day, that's more than most people get to do, on average. And I feel grateful for that.
I mean, I think being 60% heard or felt heard and being 60% or 80% happy at work, that you're lucky. You should count yourself as one of the lucky ones.
I really do.
What would you say is the worst thing about working with people?
The worst thing about working with people is probably the fact that you can't help them. For me, it's that you can't help them oftentimes the way they need to be helped. They need to do it themselves.
Yeah.
And like I have like a very specific thing in my mind when I'm saying that is like once a month I teach people manager trainings to all of my people, right? Because I learned this lesson maybe 5-6 years ago that the best thing you can do for people to have a better day to day is to educate them, right? And it makes your life better, it makes their life better. And I was teaching this class on active listening and having empathy as a listener. And I was teaching in a very purely professional manner, like, yes, when you're talking to your employee or when they're talking to you, like, here's some questions you can use to show that you're active listening, and here's how you can check in, and doing all these things that, I wish somebody had taught me as a child, frankly, for interpersonal things. And maybe 3 weeks later, 4 weeks later, I'm like prepping just like for the next class, and I get a message from one of the managers, and he goes, "Hey, I was using that like active listening thing, and all of a sudden my wife and I are fighting much less." And I was like, "Yes, that does not surprise me." And he's like, "Yeah, she said I just never listened before, and now I am. And I don't think that's true, but now that she thinks I'm listening, that's great." And I was like, I'm very appreciative that this is helping your marriage. Have you considered that this is maybe something that you haven't been doing as long as you thought you've been doing it?
Yeah.
And he's like, no, actually I hadn't. And that's like, I'm thinking about that because I can think of for like a year, his boss and I would sit in one-on-ones and be like, this guy does not listen. And his boss would say, would say that to me. And I'm like, let's start working through. And we were just tactic after tactic, and it wasn't getting through. And just magically, his wife saying, "Thank you for listening to me," for the first time, he realized, and I couldn't help him get out of his own way for a year through his boss, but he just happened to understand it. And I was like, that's the worst thing for me, is watching people not be able to get out of their own way.
Yeah, my father taught me to say my say. I grew up in a say your say house, and also to question rules and authority, at least to ask why before just doing something, but didn't necessarily teach me tact. And I've often, throughout my career and throughout my relationships, found myself completely befuddled when someone opposite me are angry or hurt by me, and I would have no idea, like why. And the tools I have today wasn't natural. And I'm still working on it. I'm fairly confident I still go weekly by kind of rubbing someone the wrong way, or messing up something I could have said in a better way or heard in a better way. But my point is, sometimes the worst of us, the tools we need to get better, we just don't have. Like being able to listen also means, I think, in many ways, to receive feedback. And you think you're good at hearing feedback, but you're probably not.
No,
No.
most people are not.
When someone would tell me when I would sit down, I remember this as a trainee, my boss was like, we've talked about this. And I think, I'm like sitting there and like, I'm like, I have no idea when we talked about this. You've never yelled at me about this before. But what she has done is like called me aside and said, hey, I just heard this thing. And to me, that was just, you're just making a comment. And what she was doing is going out of her way to come find me, to come talk to me. And I just didn't have the tools to know that I've been talked to. Um, and I, I'm still very much learning how to listen.
Same.
I think according to my wife, I'm not a great listener.
I mean, same as well. But what I've started to do is try to figure out why this situation is happening. When somebody says something to me, I'm like, okay, if this person and I don't have an agreement here on what's being said, then what don't I understand? When I was younger, I used to get very frustrated. I'd be like, why don't you just do what I'm saying? Or why aren't you just listening to what I'm saying? And now I'm like, okay, this seems like a logical thing for them to do, but they're not doing it. So what am I not understanding about what they understood or didn't understand about this situation? So when I was younger, I would get annoyed. And now my first thing is, what did you think I said? And then I hear it and I'm like, oh, that's not at all what I intended. Or, huh, that is what I intended, but we still got to a different conclusion. So here's how I got there. Let's talk about how you got there. And just that curiosity in that moment, that's changed the way I engage with people altogether. And that took me, I don't know, I'm embarrassed to say late into my 30s to figure out.
I'm 42. I'm still learning that. And I'm actually making a little mental note of what you just said. It's a little bit of what my boss said, like when you walk into a room or when you walk into a situation, immediately questioning whether you understand what's happening, and whether they actually know what you're saying. 2 high fidelity conversations yesterday that I can't discuss, that where I definitely walked away going, I don't think they understood what I was driving at all. And I definitely, my underlying emotion was frustration. I'm like, I don't know how to say this better, but I like that. You're like, what about this conversation I don't understand?
Yeah. I that mostly came, if I'm being completely honest, that came from having a wife who is infinitely smarter than me. Like, I'm not dumb, but my wife is there's just levels to intelligence, and they're much
Yeah.
smarter than I am. And so I went from being frustrated at the beginning of the relationship when they didn't understand me or I didn't understand them to being like, there's probably something I don't understand. And I've taken that into every other aspect of my life. When I don't, when there's a miscommunication, now I start with what don't I understand? And that's been incredibly valuable as a lesson for me in communication.
I like it. Yeah, same with my wife. She's remarkably smarter than I am. I always like to say with my colleagues who I work with some pretty impressively smart people and accomplished people, and the same with my wife. I'm definitely smart enough to understand how smart they are, but not as smart as they are. Like I'm the
I know
guy.
that feeling.
I'm the 11 seconds. I'm the sprinter that can run 100 meters in 11 seconds. Which is fast enough to understand just how fast 9.8 is. Um,
That's
which is
a good analogy.
Yeah. Like they're like so much smarter than I am. They get to stuff quicker. They understand
Yeah.
stuff quicker. I oftentimes have to remind myself, even my fellows, when they work with me, like they come at me somewhere in the last couple of years. I like last year, I think, or two, I won like teacher of the year for like the fellows, which is like a nice little feather on the cap.
Congratulations. That's wonderful. It's great to be recognized as a teacher.
Yeah, it was a nice little moment. And you meet all the like wins and losses the same way, right? They're both wins and losses, or accomplishments and failures are both imposters in many ways. So you meet it with some suspicion, or at least. But anyway, for a minute there, the next group of fellows would approach me with questions, and I almost immediately recognized them asking me or engaging with me in a way that they were expecting me to come back in a way more sage or smart way than I am. And I specifically think of one of my fellows who's done pediatrics, intensive care, anesthesia, pediatric adult critical care, and now our fellowship. So this guy comes in way more trained than I am, way more smart than I am, meeting me for his last year of fellowship, where he's like engaging me with conversations at a level where I'm like, hey man, let me stop you. I don't even 100% know what you're saying right now. And like seeing the disappointment in his face, I'm like, this is way too meta, or way too, you're at a different level. Thank you for thinking that you can ask me that question. Let me direct you to the guy that can answer you.
Yeah.
Um,
There's also a
but it's been
wonderful
helpful.
level of humility, like in knowing that you're not at that level.
I sometimes you don't have a choice. If you don't start humble where I'm at, they will humble you real quick.
I want to like shift gears here because I actually want to talk to you about scuba diving. Like,
Yeah, sure.
because you told me you were like a borderline brown black belt level at scuba
Yeah.
diving, and that's like, that takes a long time to get to. Like, how long have you been doing that, and how have you been doing that for so long?
You can do scuba diving. You can start, I think, at 11. Depending on like the organization. And down the street from my house, there was a little dive shop, and the owner of the dive shop still has this shop today, which is rare for scuba schools. And he was just good at like making you excited for diving. They literally get trained to do this, but he's naturally loves diving. He was just good at it, and like making you feel like this is the most fun thing. And it is. It's not a sport. You jump in the water and you go look at fishies. Most of the diving we do, unless you're a tech diver or a industrial diver, you go 50, 40, 30 foot below the ocean and go look at reefs and fishies. But I've loved it from day one. On my first, second, third open water dive, literally just that way from my house, called a place called Koei and Kalf, which is cow and calf is the dive site's name. It's just two little rocks. On my safety stop coming up as a 12-year-old on my qualifying dive, we saw a great white circling us in the false bay. And my instructor at that point, it was Etienne, I think, like really holding my BC and like making eye contact with me and telling me to calm down, and just to watch. That moment was so stuck with me, and I just enjoyed being in the ocean. I grew up in the ocean. The beach was right by my house.
Was that your like, this is my new hobby kind of a moment?
Yeah, and I did it with my dad. Like we did the course together. We dove together. Now and then he still comes along to go on dives with me, and I've just been in love with it ever since. Some people get to go a lot more than I do. I think I've just reached 500 and something dives now.
It's a lot of dives.
It's a lot of dives. I mean, my one of my buddies who I go on dive trips with, who Mikhail came on a trip with, I think he's done 5,000 dives. Like,
Yeah.
he does.
Well, there's levels
like,
to all of this.
There's levels to it.
Still, 500's a lot.
Yeah, I'm definitely like, the thing about scuba diving that I think gets most people is like this: if you're like claustrophobic, or like you think you're claustrophobic,
That's me.
So
get claustrophobic.
you have this immediate mental barrier. And my dad too, by the way, like he sits in like his wetsuit and he gets like immediately constrained. But it's this little mental barrier where you cross it, and what you get on the other side of this veil, of this emotional or mental veil, is drifting, and you're free, you're weightless. You are, if you're lucky, being taken by a little stream or by like a little current. And if you open your eyes and the anxiety comes down and your breathing slows down and your vision, same as when you get tumbled on the jiu-jitsu mat. Initially, you just like, your vision is like this, and then it just, and it's not so much training, it's just time, right? Your vision opens and you're like, fishy. Oh, little crab. Oh, this beautiful little worm that looks like a Christmas tree that comes out, and as you come closer, it just disappears and blooms again as you swim away. And you look onto the sandy bottom, and there is this what looks like a garden of grass, but what you go closer, it's like actually like a garden of eels, and they are little garden eels, literally just chilling in the water, thousands of them, or hundreds of them. And you like get closer, they disappear, and they relax around you. They come up again, they come check you out. That's the price you get, or the prize you get for like stepping over that mental veil of, oh, the claustrophobia goes away. You're not surrounded, you're not compressed by the ocean. You're in open space, the deep blue. You look away from the reef and you're looking into deep blue. It's just as far as your eyes can possibly see, ocean. I think, like clearly, I love it a lot.
That was a really beautiful description of
Sorry,
being in the water.
I talk too much. I talk too much.
I don't know why there was an apology. I genuinely thought that was a very beautiful description of it. When my claustrophobia is when I put the mask on, and I put like I got certified in the pool, and then I never did a dive because I was like, I can't get past this. This is too much for me. But I've done like snorkeling and stuff. So I know I've seen some of those things, but not at the duration and level that you're talking about.
I will tell you, and I will tell you this, I think we might tell the same thing as like we've got I can think of one person, I'm not going to name her, who we started jiu-jitsu at the same time, and she clearly came to jiu-jitsu to learn to defend herself. And I don't know her story, but there were definitely when we trained together, and I'm a white belt, she's a white belt, where there was moments where I could tell that the freak out that she's having right now has got nothing to do with me. This is a story. There's a story there, but she kept with it, and this 225-pound guy like just smashing down on her. At some point, she just started relaxing, so the smashing down is not that bad. She's like, oh, the worst that is happening right now is just a squeeze. And that's the same thing with a mask. Like we start off with like putting that mask on so hard because you're like, fuck this mask is not coming off. Like the worst thing that can happen right now is this mask coming off my face. I'm going to strap this thing as hard as I can. And then you go from 1 atmosphere to 10 meters down, which is not that many meters. I don't know what that is in feet. Thank you. Where you like now have 2 atmosphere of pressure on you. And then you go deeper and you like a third atmosphere of pressure on you. Now that mask is squeezing your face. And if from the beginning you had it more relaxed, just like barely sealed around your face, and you had one that's not squeezing on your nose or you and I both have like aristocratic noses. We have aristocratic noses.
I call it a Jew nose, but I can say that because I'm Jewish.
Yes. Fair enough. My science teacher called my big nose a aristocratic nose, and not 100% sure what that meant, but something French, I assume. But you relax the mask a little bit more, and with time, you're like also breathing more comfortably, and that mask squeeze that you just described is gone. And yeah, you start feeling it a little again when you get like deeper and deeper and deeper, but you're like, this is just a little squeeze. This is not that bad. And then you like relax even more. You like blow out of your nose a little bit, and a little bit of water and air comes here, but the squeeze goes away. Now you're actually comfortable. And so that, again, it's just a little bit of time and a little bit of a mental leap, I think. But I get you. What you're saying is pretty common. Many people never go diving because of that exact moment.
The thing was for me, like at that point, I tried it and I couldn't get over that hump. And I thought, you know what? I don't need to prove this to myself. And then I got into skydiving, and like that made me more like I was afraid of heights, but it put me more at ease to feel like I was free in the air and I could breathe at any point, rather than feeling claustrophobic in the mask and the breather.
Did you do the whole training through that you could like skydive by yourself?
Yeah, I have some just shy of 900 skydives, and I did it for 15, but there's levels to it, right? I have friends who have 100, and I have friends who have 15 to 25,000 skydives.
Jesus.
Yeah.
I mean, I've gone like the tandem thing, which is, it's
different.
a lot of fun you can have with a guy strapped to your back. It's like probably the most fun you can have with a strange man strapped to your back. But the
Depends on how you like to spend your time, but
fair enough. Like I enjoyed it. We got comfortable. But the sorry,
it's okay.
the
I really enjoyed my tandem skydive as well. I enjoyed it so much that I made it a hobby, but I had to get over my fear of heights to do that. But I could not get over my fear of my claustrophobia in the mask and in the breather, because even when I was in those moments in the heights, I could take a deep breath and myself. But when I had the breather in, the fact that I felt constricted in how I had to breathe stopped me from being able to calm myself down in an effective way.
Did you when you jumped out so you do the tandems, I assume, a couple of times, and then at some point you do like a fixed, I don't know, I want you to how the progression from like getting qualified to do this by yourself. But the first time you're jumping out of that plane by yourself, or the first time you're jumping out of a plane, do you like make peace with life and God and like, okay, I could fucking die right now?
I actually have
That's
a
the
funny
only way I
story.
got out of the plane.
I have a funny story about that. So the first 3 jumps, you go tandem and you're strapped to somebody, and they just kind of make you, can you turn? Can you get stable? Do you remember to breathe? Are you checking your altimeter? Like really basic survival stuff. And then your next few jumps, I forget the exact number, maybe 7 or 8 jumps. The first one, the first 2 or 3, your instructor goes out attached to you. The second, then they go out next to you, but they're always within arm's length. And then the last couple, they're face to face, but they're a little further away, but they're always like right there. And then at some point, I think it's maybe jump 13 or 14, you get to the point where you go solo, and that's it. And so I get to my first solo jump, and I was actually fine. I didn't really think about it. And I went out and everything was good. And I thought, I don't have this moment that everybody thinks about, the one that you're talking about. And then about a year later, I packed my parachute for the first time. And then I did a solo jump. And then I had that moment. And I was like, I was terrified that, and it was before I trusted that the parachute wanted to get out of the bag and all that stuff. It was, So I'm walking to the door of the plane, and I look out, and I'm one of the last people out of the plane. It's just me and this guy who was an instructor, but like an old school instructor, had been jumping for 35, 40 years, just a rugged, like, yeah, you'll be fine, you'll live, whatever kind of a guy. His name was Russell Gunner. I remember this, and I remember everything about what he looks like. So I get out the door and I spot, and I'm looking, and I'm like, okay, here we go. And you go down, up, out, right? I went down, up, and then I paused, and then I went down, up, and then I paused, and I was like, I packed this fucking parachute. This might be the last moment of my life. And then I was like down, and I didn't get to the up, and I got kicked in the chest. Like literally, I got kicked in the chest, and I went out backwards, like just flying. And then I see this like giant smile coming out of the plane above me, staring down at me, pointing and laughing. And I went from being terrified in that moment to being like, well, this is it. This is whatever happens. And I rolled over. He came eye to eye with me. We checked in. I smiled. He smiled, gave each other the thumbs up. We did a little buddy dive. And then I had a moment of, oh my God, is this it? I threw my parachute. It opened up. I got to the ground, and I breathed a giant sigh of relief. And so I land, and he lands and walks over to me. He goes, "You were taking too long. I got tired of waiting." And I couldn't do anything but laugh, because I was like, I was worried about, am I going to survive? And he was like, you're harshing my buzz, man. Like, get out the door. So I tried to make my peace, but I couldn't finish it because I got kicked in the chest. And then we had a good laugh about it. And he's like, "Don't tell anybody I did that." And I'm like, nobody would believe me. This was almost 25 years ago. So.
Oh my God. So did you do the accelerated
Yes, AFF, accelerated free fall. Yeah, that's what I did.
That sounds, I feel like it's on a bucket list. Like it's for me on a bucket list
Yeah.
of stuff. It feels a little irresponsible with children, but I'm like, it's like anything else. I might as well
Safer
just
than
go do it.
driving, to be honest.
Yeah. I mean,
Statistically speaking, you're less likely to get hurt on a skydive than you are but getting behind the wheel.
and do you think that moment of yours was because you're like, oh, I've like taken like the parachute that all the jumps you've done, the parachute I have on my back psychologically and actually in real life is my lifeline. Someone that knows what they're doing did this for me.
Yeah.
This is as standardized as it can be. This is as safe as it can be.
That's what I felt until I
your life is
realized.
and now your life is in your own hands, like literally in your own hands. You did this to yourself. If you die, you did it. That's what happened to you, right?
That is exactly what happened. And then once you get used to packing a little bit and you realize that the people who pack are just also kind of throwing it in there, and you and you realize that that's actually fine. Like there's like a few things that you have to be very careful about, but you just like anything, when you do something repetitively, you build the muscle memory, and you're not worried about like, oh, did I thread this line exactly? Like if you didn't, like it's, you would have known because some other thing would have gone wrong.
Because like you said it earlier, the parachute wants to come out of the
because you're stuffing it in a bag that's its weight. The parachute, like it wants air to be in it. It wants to be open. It's very slippery fabric, and you stuff it in this little bag. And as soon as it's like, if you open the bag, the parachute just kind of comes out. And as it starts coming out, it immediately fills with air and just, and physics does the work.
And then do you have a backup parachute in there?
In skydiving, yes. In base jumping, no. And that was also a bit difficult for me when I did my first base jump, realizing like it's a one and done. And if I don't
You've done base jumping?
Yeah, I don't have that many base jumps though. I think I only have like 12 or 13 base jumps.
I mean, one is too many. That's a dangerous game. That's a whole different.
It is a bit. Yeah.
Like, oh my God. Like it sounds awesome, but for no. Gee, no.
It's like with anything else. I was listening to some of your stories and thinking, nope, I don't want to be in that situation. But there's a point in which you get kind of comfortable with these things, and this is actually a great example. You do your gear checks, right? You do your gear checks. You get on the plane. You're getting ready to get out, and you check yourself. Did I route my straps correctly? Is my pilot chute, is my pouch, like all of these things, they have to be, you check yourself. You do your emergency procedures, and at a certain point you get complacent. I got complacent at some point, and maybe around jump 300-400, I forget exactly when it was. I misrouted my chest strap. And if you do that, you can fall out, right? You can fall out and then there's no parachute on you because your main and your reserve are gone. Unlikely to happen because I'm a big person, but I misrouted the chest strap, and I went up, and one of the instructors was like, I'm looking at your gear. You just did your gear check and your chest strap's misrouted and you missed it. Ride the plane down. Now I could have ignored her and said, no, I paid for this route. I paid for this ride. I'm going out. But, she put her foot down and was like, you did not do what you were complacent. Did you make any other mistakes? And I was like, well, I actually don't know that. And it made me stop, and I rode the plane down, and it was the one and only time I have been so complacent that I did not think about everything that I needed to do to save my own life. And I probably would have been fine. But that was a hell of a lesson, like being annoyed at myself, riding the plane down, thinking, as a relatively broke, I wasn't a college student anymore. I was just out of college, but as a relatively broke person, I'm like, I just wasted $20. I rode up and then I rode down. I didn't even get my fix.
Yeah.
But it was a good lesson. Yeah. It was a good lesson. And it taught me a lot about being complacent and when not to be complacent, especially with your own life.
We have a pediatric anesthesiologist or we get teased for how particular we are about what goes where, and like it's all style, like a lot of it is style points, but what drug is open, what is like our dosing, blah blah blah. And if you speak to me a little bit, I will tell you my style is a little more like cooking, or like I can't 100%. and then one of my colleagues will hear this right now and like, wait, you didn't give exactly 1.4 cc's, you gave like maybe 1.4 cc's. There's a difference. So I can tell you I'm about to get an argument if someone hears what I just said. That there is a moment where you like get to a place where you like, and your comfort level where you like do a little bit of what, et cetera, et cetera. My point is, there are a couple of hard stops. Like I don't start at anesthesia. No one does without a suction working, a working suction. Like if you don't have something to suction spit, blood, vomit coming out of the airway, and that stuff now goes into your lungs, you give that kid or that patient a really bad outcome. They get like a chemical pneumonia from what just happened. Suction, don't hard stop. So I've done that. I've been kicked out of an OR for starting a case, and my attending checked the suction and went, "You're out of here. You're not doing today." And I've done that to fellows and trainees where I'm like, almost everything else is excusable. This is not. Get out of my OR. And it happens to everyone at least once. And then like you said, you go away being annoyed about like, well, I did everything else. It would have been fine. It's fine the whole time. I know you haven't checked the suction once. I don't care. Go get a cup of coffee. I think everyone needs that moment for all of us. I'm sure pilots have that same thing where they like hit a bird or whatever the fuck they do. You know?
Yeah, they do. And I think this is, I mean, just to almost come full circle, this is actually the thing that I love about jiu-jitsu so much is that you get humbled. Like that moment of like, oh, you need the suction or your chest strap's not routed. Like that's being humbled in the thing that you think you're good enough to do regularly. And that's one of the reasons I love jiu-jitsu so much is that I get humbled. I think I'm doing well. I'm teaching. I know a move. And then some white belt like takes me down and I'm like, I was an All-American wrestler. How the hell did this just happen? But I get humbled. And I like that because it's a good reminder that, you know, if you are as good as you think you are, then you're probably not thinking clearly about what level you're at and where you need to be and where you can be and taking the right kind of approach to life for that topic.
I think about what you just said a lot. Because to do what I do and to do what we do, it requires a bit of confidence, right? And I think we fool ourselves sometimes. Like I've almost got like a now and then like I say yes to doing cases that a colleague wouldn't say yes to, not so much because I'm smart or better at doing the job. I'm just probably dumber than they are. Probably like a little overconfident in saying yes. And then either the case is going to humble you or the colleague's going to point it out something you did wrong and humble you. And I have to tell myself that all the time. Like, I'm not as good as I think I am. And specifically on jiu-jitsu, that was hard for me. I used to be the guy that could, like, Mikhail makes fun of me. He said, you know, Dricus du Plessis, the MMA fighter?
Yeah, of course.
Yeah, Mikhail calls me Dunkus du Plankus because he's like, my jiu-jitsu is shock jiu-jitsu, which is his very impolite way of saying that I'm not as technical as the rest of the guys. And I'm like, I'm very technical. What are you talking about? I'm like, no, I don't train nearly as much as the rest of you. You're probably right. And then when I'm getting smashed by said blue belt we talked about earlier, I'm like, yep, I'm probably not as good as I think I am. And I have to get comfortable with that. Like, it's probably a good thing to be reminded that I'm, just not that good, and it's okay.
I love that about jiu-jitsu. And that's, I think, what keeps me humble in all of life is just having those moments on a regular basis, whether that's professionally or jiu-jitsu or in when it happened in skydiving, all of those moments.
And watching my coach dismantle a high-level black belt, no matter the size, man, that's cool. And then, like we said, there's levels to it. We had these guys visit, watching competitors actually challenging, and I'm seeing, and his face is not frustration, because he knows it's good. He knows how good he is. He's like kind of a little bit of a servant in it, but so there must be some ego there, I think. But watching him smile when someone challenges him, where he's like, "Yes, he's going back to that feeling you and I have. Like, what we love about jiu-jitsu is humility, and like, here's someone humbling him a little bit, and he loves it. There's some that suck is good for you. We know it, right? And watching him do that to other black belts is pretty cool.
I had this conversation with a student actually earlier in the week, because we were doing something where, like, if you do it wrong, like if you a little bit of a wrestle up, you kind of get thrown. And I was showing somebody something, and I was like, look, and here's what happens when you do it wrong. And then, like, one of the people did judo, and I was like, this is what happens when a judo person gets a hold of you and you do this wrestle up wrong. So I showed them, and then I went for a ride, and I was like, wee, and I just kind of, because I genuinely enjoy sometimes when stuff like that happens. Two of the students, when they paired up to do the drill, were like, you can't say we in a tournament. Like you can't, like, you'll get disqualified. And I'm like, yeah, that is true. But you're not here because you're a professional. I'm not even a professional at this. We're here because we're having fun. And so sometimes somebody gets something on me, and yeah, I might need to tap, but I'm like, I will just watch it happen. I will watch myself get submitted and be like, that was so sneaky. And
Yeah.
sometimes people be like, wait, why didn't you fight it? And I'm like, well, I was actually just enjoying your work. Like, I'll get out of another one in the future, but this one was interesting, and I wanted to see what happened.
Mikhail's wife, Sui, just became a brown belt. She did a well-worked armbar on me earlier this year, where halfway through, I'm like, I could fight this probably. I could, like, muscle myself out of this. But she did this so slickly, where she transitioned from back to me on my getting up on all fours to, like, attacking my neck. And the next moment, she was, like, slowly just, like, getting my arm away from me and trying, like, it was so beautifully worked. I'm like, fuck it, this is yours, man. And I was genuinely, it sticks with me because I, like, remember going, man, I don't think I would have been getting out of this no matter who I am. This was so cool. Good for you, man. This is so cool. And, like, that armbar sticks out with me because it was so well worked. Anyway, yeah, kind of just echoing what you're saying.
It's a beautiful thing when you see jiu-jitsu done. Look, you have done so many things in your life, and you've talked about so many great stories, like, and actually also horrible stories. But what piece of advice do you have for people, having been through so many of these things?
I think a lot of it is luck. Like I touched on a little bit earlier. It's like a gentler and kinder philosophy of success. Like, we are in many ways masters of our own fate, but also in many ways not. And when you have triumphs, like, spend a moment really enjoying and celebrating them. My wife teaches me to do that because I sometimes don't. But same thing with losses. Breathe nothing about it, and it's just a momentary imposter. I built a beautiful life for myself, mostly thanks to my wife. Like, I have to say that aloud. I live the life I live because of my wife. Like, in many aspects, from pushing me to do what I do, etc., and keeping me out of HR a lot. The mental and instrumental are getting me out of HR. But my point is to, like, if you wanna live the life you want to live, I think you need to go sit down and do it, like, same with a math problem, and go write it down. Everything I've done, everything I've achieved has been a product of writing it down. Like, hey, what do I want my house to look like? What do I want my body to look like? What do I want my what do I want to feel like every day? Like, I went and I skeletonized my entire life. And I wrote it down. And now I've got, like, since the age of 17, almost every year I write down 10 things I'm going to do for that year. Some of them is just for that year, and some of them is to some later on goal. And it's remarkable, just writing them down, how many of those things I can tick off every year. I think we've got 4 months left or 5 months left of this year. And despite having a ridiculously busy household, like house life at the moment with small kids and work, let me see if I can find it. This year's 2025, I told myself to be more quiet and trying to learn how to be more diplomatic. It's not going that well. But
Can't get everything.
we can't get everything. But briefly, of all the things I wanted to do for the year, I'm about to tick off all of them.
Amazing.
I would say the only thing about it was I wrote it down. I thought about it for a hot second and I wrote it down. And if I don't get it, kinder, gentler philosophy of success. I'm like, it's okay. It's like whatever. Does that answer your question?
Yeah, absolutely. It's just
It's a little
like
preachy.
what do people what do what was a piece of advice that you have? And I think you kind of your thing was write it down. One thing I do want to say though is I've always defined luck very specifically. I don't even remember where I heard this, but I feel like a very lucky person, but I've always defined luck as when like opportunity meets preparedness. And like I try to be ready for whatever is going to be there, and I try to be able to recognize it. And if I can recognize it and I can go after it, then I'm ready for whatever I'm going after.
Did you ever read The Old Man and the Sea by Hemingway?
No, actually.
It's 100 pages. It's what Hemingway won his Pulitzer Prize for.
Yeah.
The old man is sitting in his boat thinking of just what you just said. He's like the Cuban saying, he talks about the Cuban saying, it's better to be lucky than good.
Yeah.
And the old man is sitting there musing and he goes like, actually, you got to be good so that you're ready when you get lucky. And I really like that. I really like that take on it. You gotta say yes to some stuff, and you gotta prepare a little bit for when you get lucky.
Now I have to read the book, which
It's so good.
it's kind of amazing that I have that.
And it's an easy recommendation because I think it's 100 pages. It's an old man rows out, catches a fish, and it's his time on the boat, and it's really good.
All right, I will absolutely read it. I just think it's funny that I have this view of it and I'd never read it, and I must have come across that at some point, but I've never actually read that book.
Please do.
I will, and I will reach out to you as soon as I read it. What are you excited for in the future?
I've got a little one on the way.
Nice.
So 10 more toes in the house. And I'm heading out to South Africa. I don't get out a lot, so I'm pretty excited to go see my family. I'm just gonna use my 40s. I've got 7 more years of being 40 to do the things I said I'm always gonna do. Maybe learn that language, maybe pick up that guitar for the first time. And I'm a little excited to do. I'm like more than excited to do that.
I love that.
Yeah, I'm gonna make this 40s fun and full.
That sounds fantastic.
A wide life, it doesn't have to be a long one. It has to be a wide one.
Yeah. Cool. I think that's a wonderful way to wrap this up. Paulus, this was a super fun conversation.
Same.
Thanks so much for your time.
We should have asked you a lot more about you. You've got fascinating stories, and I feel like I missed out. I did the same thing you said. I talked about myself for 2 hours, and I'm like the skydiving is fascinating.
It's all right. Like I said, this is just a conversation. It doesn't have to be the last one we have.
Awesome.
Anyway, thank you so much for your time. I really appreciate it. And yeah, thanks, you.
Eric. Bye.
Bye.
Thank you for listening. If you have any questions about scuba diving, anesthesiology, or teaching doctors, feel free to reach out to Paulus. If you find yourself near Philadelphia, Pennsylvania, USA, try to catch him for a role. You can find his contact information in the show notes. And as always, thank you for your time and attention.